You're watching Fox 45 Morning News. All local, all morning.
Well, June is National Migraine Awareness Month. Coming up, why summer months are considered peak migraine season and what you can do to prevent them. 7:20.
June is National Migraine Awareness Month, and the summer is a brutal season for more than 30 million Americans who suffer from migraines. Dr. Elizabeth Hamilton with MedStar Harbor Hospital is here now to explain the difference between a headache and a migraine, because you hear a lot about migraines, but if you've never experienced it, you have no idea what you're in for, really.
Right. So a migraine is typically on one side of your head. It's throbbing or pulsing in nature. It can be quite severe. It's often associated with sensitivity to light and sound, and it can be associated with nausea and vomiting. It's made worse with physical activity, and it can be very incapacitating.
Is there an age, does it matter at what age you might be able to get a migraines? Are adults more prone to it, or is it children?
Migraines can start as early as 5 years old, and they can extend throughout adulthood. They usually start to get better or go away around the age of 50.
Now, rumors are that it's summertime months, you normally start hearing more about migraines there, but you're saying that that's not necessarily true.
I mean, many things can trigger a migraine, and weather changes is one of them.
Okay. And so how do you get diagnosed then? I mean, if you were going in, I'm a parent, so if my kid starts complaining that they have a headache, I'm like, all right, just, take some ibuprofen and you're good to go. Come on.
Well, the diagnosis is basically based on the history. So it's based on those typical classic findings that I've mentioned.
And so when you have the seasonal, is there anything else besides your regular over-the-counter medicines that somebody that's suffering from migraines could take?
Yes, yeah. There's very effective drugs, a class called triptans that are really wonderful, really safe in the right person. Those are prescription medications. They're very good.
Okay, and they're only prescribed by doctors. You have to go there. Any side effects or?
Yeah, there are some side effects. You might feel some chest pressure or chest squeezing. You might feel a flushed sensation or numbness and tingling in your skin. You might have some nausea from it.
What's the best thing to do then? If, say, you don't have the prescription ready, how do you handle somebody? Do you want to give them ibuprofen? Is that going to help a little bit, or do you want to try and avoid that and just wait and get the right medicine?
Well, it depends. Ibuprofen can be very helpful. Over-the-counter anti-inflammatory type medications can be helpful. Lying quietly in a dark room, you might want to have some ice or a cold cloth around your neck or over your eyes. That can be very soothing for a migraine sufferer.
And then is there really any time that you may grow out of migraines? Have you heard of that, or is it more or less like a lifelong event?
No, oftentimes they'll get better after the age of 50. If you're a woman after menopause, sometimes those hormonal fluctuations have stopped, and so the migraine headache should get better.
All right. Dr. Hamilton, thank you very much. MedStar Harbor Hospital.
Thank you. Yeah, great to be here.
Thank you very much for coming in. Jeb